A critical and often unspoken reality within healthcare is that certain routine health checkups frequently recommended for senior citizens can paradoxically inflict more harm than benefit. This phenomenon can manifest as unnecessary treatments, avoidable complications, or even the precipitation of severe health crises that could have otherwise been prevented. Millions of older adults faithfully undergo these annual screenings, operating under the well-intentioned belief that they are diligently safeguarding their health. However, a growing body of emerging research suggests that a substantial proportion of medical tests administered to this demographic, estimated to be as high as 37%, result in unintended and adverse consequences. The sheer scale of this issue is amplified by the fact that an overwhelming majority, approximately 99% of individuals who have surpassed the age of 70, remain entirely unaware of the pervasive potential for overtesting and the associated risks it carries. Disturbingly, one specific screening has been identified as particularly problematic, intricately linked to a notable percentage of cancer diagnoses, a statistical impact comparable to the effects of daily alcohol consumption. This vital information, often buried within the intricate details of scientific studies, is regrettably seldom disseminated through conventional medical channels, leaving a significant knowledge gap for those it most directly affects. This comprehensive discussion is designed to illuminate 5 specific health checkups that seniors, particularly those over the age of 70, should carefully consider foregoing, unveiling the alarming truths behind their potential negative ramifications on the human body, all of which are firmly substantiated by robust scientific evidence. Before we embark on this detailed exploration of potentially harmful screenings, your individual insights and experiences are invaluable to us. We earnestly encourage you to share in the comments section below where you are viewing this information from, your current age, and any personal anecdotes you may have regarding tests or procedures that you later regretted. Furthermore, we are keen to hear your perspective. Do you believe that seniors are subjected to an excessive number of medical tests? We are deeply committed to meticulously reading and thoughtfully responding to every comment, aiming to offer personalized advice tailored to your unique circumstances. In addition to this, we also encourage you to show your appreciation by liking this video and subscribing to our channel for a continuous stream of essential and timely health information designed to empower your well-being. Commencing our exploration with the 5th item on our list, the bone density scan, or DEXA scan as it is officially known, while appearing to be an entirely innocuous diagnostic tool, harbors a significant potential to negatively impact an individual's quality of life. This procedure's primary purpose is to measure bone strength and is largely employed in the detection of osteoporosis. However, for individuals who have advanced beyond the age of 70, these scans frequently generate a disproportionate amount of anxiety without delivering commensurate tangible benefits. The results of these scans often indicate a lower bone density, even in instances where there is no genuine or imminent risk of fracture. This is because a decrease in bone density is a natural and predictable consequence of the aging process, akin to the development of wrinkles on the skin or the appearance of gray hair. The consequence of such findings can lead to seniors being prescribed medications, such as bisphosphonates, which, while intended to fortify bones, carry a spectrum of serious side effects. These can include osteonecrosis of the jaw, a debilitating condition characterized by the death of jawbone tissue and severe esophageal irritation. Rigorous scientific studies have conclusively demonstrated that the pharmacological intervention for mild bone loss in individuals over the age of 70 yields a negligible effect on actual fracture rates. For illustrative purposes, consider a pivotal study involving over 1,200 women who were all above the age of 70. This research found that the administration of bisphosphonates reduced the risk of fracture by a remarkably small margin of only 0.3% over a 5-year period. Concurrently, however, these medications significantly increased the likelihood of experiencing a range of adverse effects, including severe digestive disturbances, inflammation of the esophagus, and a peculiar form of bone fragility leading to unusual fractures. To further contextualize this, let us examine the case of Rose, a 76-year-old piano teacher. Despite never having experienced a fall or any associated pain, she underwent a DEXA scan following her annual medical checkup. The scan revealed osteopenia, a diagnosis indicating a mild reduction in bone density. Her physician promptly prescribed a bisphosphonate medication. Within a mere 3 months of commencing this treatment, Rose began to suffer from severe reflux and excruciating jaw pain, rendering her unable to continue playing the piano, an activity she cherished. Upon discontinuing the medication and diligently implementing lifestyle modifications, which included vitamin D supplementation, engaging in weight-bearing exercises, and adopting a calcium-rich diet, she successfully regained her ability to play. For seniors over 70 who are not experiencing falls or fractures, a focused approach on strength training, balance-enhancing exercises, ensuring proper nutrition, and proactively addressing any vitamin D deficiencies can demonstrably reduce fracture risk, with some studies suggesting potential reductions exceeding 20%. It is therefore crucial not to allow a numerical output from a diagnostic scan to dictate the initiation of unnecessary and potentially detrimental treatments. Proceeding to the fourth item on our list, we address the brain MRI for the evaluation of memory loss. The gradual onset of forgetfulness or confusion in senior individuals often engenders significant fear and anxiety, frequently prompting concerns about dementia or Alzheimer's disease, which in turn leads physicians to order brain MRIs. However, these sophisticated imaging scans, which provide highly detailed visualizations of brain structures, rarely furnish the definitive and conclusive answers that patients and their families earnestly seek. In a significant majority of cases, MRIs performed on individuals over the age of 70 reveal what are considered normal age-related changes. These often include slight reductions in brain volume or the presence of small white matter lesions, both of which are entirely typical and expected findings in older adults. The mere presence of these findings, however, can unfortunately initiate a distressing cycle of escalating fear, further diagnostic investigations, and, in some instances, even surgical interventions that may offer no discernible improvement in memory function and could potentially exacerbate existing cognitive difficulties. A comprehensive study published in 2021, which meticulously analyzed over 3,000 brain MRIs conducted on patients aged 70 to 85 who presented with mild cognitive complaints, revealed a striking statistic. While an impressive 86% of these scans displayed abnormalities, only a scant 3% were definitively linked to a treatable underlying condition. This implies that a substantial majority of these individuals experienced significant emotional distress and psychological burden stemming from findings that were, in fact, not indicative of any serious or progressive illness. Furthermore, the study highlighted that nearly 12% of these patients subsequently underwent invasive procedures, such as spinal taps or exploratory biopsies, based on the interpretation of these ambiguous scan results. George, a 74-year-old retired engineer, serves as a poignant example of this scenario. He was experiencing occasional bouts of forgetfulness, which he found concerning. His subsequent brain MRI revealed white matter changes, leading him to a deeply held belief that he was developing dementia. This conviction prompted him to voluntarily withdraw from driving and to significantly reduce his social interactions, leading to a profound sense of isolation. While his anxiety escalated, a subsequent reassessment utilizing a standard, simpler cognitive screening test revealed that his scores were, in fact, within the normal range for his age. Upon clarification that the MRI findings were merely age-appropriate variations and the implementation of lifestyle interventions, including advice on improving sleep hygiene, ensuring adequate hydration, and engaging in mentally stimulating brain games, George gradually regained his sense of well-being and confidence. Therefore, unless there are pronounced and severe neurological symptoms present, such as seizures, rapid and significant personality alterations, or a marked decline in functional abilities, a brain MRI is seldom of substantial benefit for the evaluation of mild memory loss. A more appropriate and significantly less anxiety-inducing initial step in such cases is a cognitive screening test, a relatively simple assessment that can be administered using paper-based questionnaires to evaluate memory, attention span, and problem-solving skills. Moving our attention to the third item on our critical list, we encounter the cardiac stress test. This diagnostic procedure is widely administered to senior individuals who report experiencing mild fatigue, intermittent chest tightness, or a general, albeit vague, sensation of feeling unwell. The stress test is designed to meticulously monitor the heart's electrical activity and rhythm during periods of simulated physical exertion, with its primary aim being the detection of any potential arterial blockages. However, for individuals who have advanced beyond the age of 70, particularly those who do not exhibit clear or definitive signs of established heart disease, this test frequently proves to be not only unhelpful but potentially detrimental. It often leads to the generation of false alarms, consequently triggering unnecessary cardiac investigations and invasive procedures that carry substantial inherent risks. A primary concern surrounding the cardiac stress test is its accuracy, or rather, its propensity for error. In adults over the age of 70, the rate of false positive results can ascend to as high as 40%. This means that in a significant proportion of cases, the test erroneously indicates the presence of a problem where no actual cardiac issue exists. This diagnostic inaccuracy can then precipitate a cascade of further, more invasive tests, such as coronary angiograms, and in some instances may lead to the implantation of stents or the performance of bypass surgery when these interventions are not medically warranted or indicated. A major study published in JAMA Cardiology revealed a particularly concerning statistic. Over half of all stents implanted following referrals from stress tests were placed in patients who were entirely asymptomatic and who derived no tangible benefits from the procedure. Moreover, these patients did not experience any measurable improvement in their survival rates or their overall quality of life following the intervention. Instead, they were exposed to an elevated risk of complications, including significant bleeding events, potential kidney injury attributable to the contrast dyes used, and prolonged hospital stays. Raymond, a 75-year-old former postman who maintained a generally active lifestyle, experienced the detrimental consequences of such a scenario. A routine medical checkup led to him undergoing a stress test due to occasional episodes of fatigue during periods of exertion. The results of this test were equivocal, prompting his physician to recommend a cardiac catheterization. This invasive procedure revealed mild arterial narrowing, and subsequently, a stent was implanted. Tragically, Raymond subsequently suffered a severe reaction to the contrast dye, leading to the development of kidney problems and necessitating a lengthy hospitalization. Throughout this ordeal, his original symptom of fatigue remained entirely unchanged, as it was ultimately determined not to be cardiac-related in origin. For individuals over 70 who do not present with classic unmistakable cardiac symptoms, safer and less invasive diagnostic alternatives are often available and more appropriate. These include a resting electrocardiogram, EKG, or a coronary calcium scan, both of which can provide valuable information without the significant risks associated with a stress test. At the second position on our list of potentially harmful checkups, we find the colonoscopy. This procedure, which involves the insertion of a flexible camera to meticulously examine the lining of the colon, is not always advisable for individuals who have reached the age of 70 and is rarely recommended after the age of 75, unless specific concerning symptoms are present. The inherent risks associated with undergoing colonoscopies tend to escalate significantly with advancing age. The necessary preparation for a colonoscopy typically involves the administration of potent laxatives, which can lead to a range of adverse effects, including dehydration, dizziness, and potential kidney complications, particularly in older adults. Furthermore, the sedation agents used during the procedure themselves pose additional risks to cognitive function in the senior population. Beyond these preparatory and sedation-related risks, the procedure itself carries the potential for serious complications, such as significant bleeding, perforation or tearing of the colon wall, or even disturbances in heart rhythm, especially during the administration of sedation. A comprehensive study published in 2019, which meticulously analyzed data from over 1.3 million Medicare patients aged 70 and older, yielded a stark revelation. For every 1,000 colonoscopies performed on patients over the age of 75, only an estimated 2 lives were saved. In contrast, over 20 individuals experienced serious complications directly related to the procedure, resulting in a profoundly unfavorable risk-to-benefit ratio of approximately 10.1. It is also crucial to note that even when polyps are detected during a colonoscopy, many of these are small and exhibit slow growth rates. In the context of older adults, the potential harm caused by the removal of such minor polyps may actually outweigh the benefit of their removal, particularly when compared to leaving them undisturbed. Dana, a 73-year-old grandmother who presented with no symptoms and no personal or family history suggestive of colon cancer, underwent a screening colonoscopy at the strong urging of her physician. During the procedure, a polyp was removed. However, shortly thereafter, Dana experienced severe abdominal pain and fainted, leading to the discovery of a bowel perforation, a life-threatening complication that necessitated a prolonged and arduous recovery period. A thorough review of her medical history revealed that she had previously undergone 2 clear colonoscopies, rendering the repeat screening procedure entirely unnecessary. Reflecting these findings, the U.S. Preventive Services Task Force now recommends ceasing routine colon cancer screening at the age of 75 for the majority of individuals. For those who are in exceptionally good health and have a low-risk profile, a non-invasive stool-based test, such as the fecal immunochemical test, FIT, offers a considerably safer alternative. This test requires no bowel preparation or sedation and can still effectively identify cases that warrant further investigation. It is of paramount importance for patients to proactively discuss these alternative screening options with their healthcare providers, as once an individual is placed on the pathway for colonoscopies, it can often be challenging to opt out of subsequent recommendations. Finally, at the very apex of our list, at number 1, we address the annual full-body CT scan. This particular imaging modality is often marketed as a revolutionary tool for the early detection of cancer, frequently included as part of premium executive health packages. However, these scans are associated with a significant and often undisclosed risk. They subject the body to a considerable dose of ionizing radiation. For individuals who have surpassed the age of 70, the probability of these scans triggering a cascade of unnecessary follow-up investigations, potentially leading to invasive biopsies and even unwarranted surgeries, is alarmingly high. Critically, there exists a striking deficiency in robust scientific evidence to unequivocally support the benefit of performing full-body CT scans on asymptomatic adults. Each individual scan delivers a radiation dose ranging from approximately 10 to 20 millisieverts, a level of exposure equivalent to that of about 500 standard chest X-rays. A significant study published in JAMA Internal Medicine in 2023 suggested that the rapid and widespread proliferation of CT scans across the United States may now be a contributing factor to as many as 5% of all cancer diagnoses, placing the diagnostic use of CT scans on par with daily alcohol consumption as a cancer-causing factor. This implies that 1 in every 20 cancers diagnosed could potentially be attributed to a medical scan that was ostensibly intended for disease prevention. These scans possess the capability to detect benign findings such as small nodules, calcifications, or cysts, many of which are simply normal, age-related variations within the body. However, the detection of these incidental findings frequently initiates a relentless chain reaction of further investigations, invasive biopsies, and a substantial increase in patient anxiety. Marcus, an 80-year-old gentleman who felt perfectly well and was participating in a senior elite health checkup, experienced precisely this scenario. His full-body CT scan revealed a tiny nodule, which subsequently initiated a relentless chain of referrals to oncologists, further diagnostic PET scans, and a needle biopsy. While the nodule was ultimately confirmed to be benign, the biopsy procedure itself resulted in a collapsed lung, necessitating hospitalization and a recovery period of 2 months. Leading medical experts now strongly advise against the routine use of full-body CT scans for general screening purposes in asymptomatic adults. They emphasize that reputable organizations such as the American College of Radiology find no proven benefit associated with such widespread screening and highlight the significant potential for harm. Targeted imaging remains appropriate when specific symptoms are present, such as unexplained weight loss or coughing up blood, but performing a whole body scan without a specific clinical indication or focus is strongly ill-advised. A more prudent and effective approach to maintaining one's health involves attentively listening to your body, establishing and maintaining regular checkups with your primary care physician, and selectively opting for diagnostic tests that are clearly indicated by your individual health status and symptoms. Your health and overall well-being are far too precious to be compromised by fear-driven screening protocols that could, in the long run, leave you in a demonstrably worse physical condition. In conclusion, while the advancements in modern medicine are undeniably powerful and offer extraordinary benefits, it is essential to recognize that these medical interventions are not infallible. In many instances, a less is more approach to medical testing and treatment can be the most beneficial. We strongly encourage you to always inquire about the potential implications, risks, and benefits of any proposed medical test. If the inherent risks appear to outweigh the potential advantages, it is entirely reasonable and often prudent to consider pausing and reevaluating the necessity of the procedure. True prevention and robust health are fundamentally rooted in a healthy lifestyle. Maintaining consistent physical activity, adhering to a nutritious diet, ensuring sufficient sleep, and making well-informed, discerning choices about your medical screenings and interventions. We sincerely invite you to share your personal experiences in the comments section below regarding any complications you or a loved one may have encountered from unnecessary medical tests or treatments. Your individual stories are incredibly valuable and can serve as a vital resource for others navigating similar health decisions. Thank you for dedicating your time to watch and engage with this crucial health information.